How does sample quality affect molecular TB test accuracy? Imagine trying to find a tiny needle in a haystack. That's similar to how molecular tuberculosis tests work. They look for tiny bits of bacterial DNA in a sample. The quality of that sample makes a huge difference in how accurately the test can detect tuberculosis. If the sample is good, the test is more likely to find the bacteria if it's there. But if the sample is poor, the test might miss it entirely, leading to a false negative. This can delay diagnosis and treatment, which is why sample quality is so important. Most molecular TB tests use sputum, which is mucus coughed up from the lungs. But sometimes other samples like stool, tissue from outside the lungs, or combined samples are used. The type of sample matters because some are better at revealing the bacteria than others. For example, stool samples can vary a lot in how well they work, with sensitivity ranging from very low to perfect, depending on how they are collected and processed. Sputum samples from patients with active, smear-positive TB usually give more reliable results because they contain more bacteria. When bacteria are abundant, the test can detect their DNA more easily, increasing accuracy. Bacterial load, or how much bacteria is present in the sample, also plays a key role. If the sample has many bacteria, the test sensitivity can reach very high levels. But in cases where bacteria are scarce, such as in smear-negative patients, the test might not find the DNA, resulting in a false negative. This is especially true when the bacterial count is low, making detection more challenging. How the sample is handled from collection to testing is equally critical. If samples are exposed to heat or delays occur during transport, the DNA can break down. This degradation reduces the chances of detection. That's why proper storage and quick processing are essential, especially in field settings where conditions may not be ideal. Proper processing techniques, including steps like decontamination and extracting DNA carefully, help ensure the test works as intended. Variations in these methods can lead to inconsistent results across different labs or settings. Sometimes, multiple samples are combined into one test to save time and resources. This pooled testing can be effective, but if one sample is of poor quality, it might lower the overall accuracy. Studies show that pooling 3 or 4 samples still maintains high agreement with individual testing, but if the samples are not equally good, some bacteria might be missed. Laboratory quality assurance programs also play a big part in ensuring reliable results. When labs follow standardized protocols and regularly check their procedures, the chances of errors decrease. Consistent sample collection, proper handling, and strict adherence to validated methods help improve the reliability of molecular TB testing. In summary, the quality of the sample, its type, bacterial load, how it is collected, stored, and processed, directly impacts how accurate the molecular TB test will be. High-quality samples with enough bacteria and proper handling lead to better sensitivity and specificity, making diagnosis more reliable. On the other hand, poor quality samples can cause false negatives, which might delay treatment and worsen health outcomes. That's why healthcare providers emphasize strict protocols for sample collection and processing, environmental controls during transport, and ongoing quality checks in laboratories. Always remember, for the most accurate diagnosis and personalized advice, it's best to consult healthcare professionals who can evaluate your specific situation.